Welcome to Mental Health Minutes, an extension of Keely Life, where we explore the H in heal regarding mental wellness. With these conversations, we hope to take the stigma out of mental health and finding a common language amongst us. We're here with Melissa Swank, our very own, as well as Dr. Holly Codner. She graduated from the University of Missouri, Kansas City, 6-year medical program in 2001. She completed her obstetrics and gynecology residency in Kansas City in 2005, and later that year returned to St. Louis and joined Balance Care for Women as a board-certified OBGYN, where she's currently practicing today. In 2018, she became a certified acupuncturist, expanding her tools to help women find their balance. Welcome so much, and thanks for taking some time to speak with us this morning.
Thank you so much for having me and inviting me.
Yeah, it's such a pleasure. So we are just going to jump right in. We're very excited to explore this subject. It's something, that as women, I know has come up a lot this month with it being Pregnancy and Infant Loss Month. And so wanted just to take some time and speak to someone that lives in it day in and day out and ask some questions. So I really appreciate it.
Yeah, sure.
Cool. So I'm going to jump right in. So clearly losing a pregnancy spurs incredible feelings of loss and sadness, no matter who you are. Yet I feel like no one ever talks about it. Is it rare to lose a pregnancy?
So, unfortunately, probably statistically about 10 to 15% of all known pregnancies end in a miscarriage. And by definition, miscarriage is when the baby passes away in the womb prior to 20 weeks. And most miscarriages do happen in that first trimester. However, losses can happen throughout the course of an entire pregnancy. So it's hard. Either way, it's hard, and it's
right. Why do you feel that a lot of don't talk about it, or that you're that you don't know that you share a common journey with someone?
I think it's just difficult. It's so hard to say. I mean, each one of us, we're so different. We're so individual. How we handle loss, how we handle things. It's just each of us is very different. I'm not really sure why there is such a social stigma about talking about it, other than the fact that you are repeatedly reminded by other people of your loss. But I do think it does help to speak of it, as long as it's within your safe place with your family and your friends, where you feel comfortable talking about it and speaking of it.
So a lot of women, I've heard this before, and actually all the time, they think they've done something wrong to cause the pregnancy to fail, that they look inward and feel like they must not have done enough of something, or, the lack thereof. So can you talk about that a little bit more? Is there any truth to those statements?
No, that's not true. Our body, our uterus, it does a beautiful job protecting our babies. So it's really difficult to say eat something or do something or think something that would make a baby pass away. So I would not go there at all. Mm-mm.
So for women who are pregnant, seeing or feeling anything out of the ordinary may send a shock of fear that they'll miscarry. Do you have any telltale signs that something is wrong that a woman can do? If anything, to intervene? For instance, should we be kick counting? A lot of mothers are, I know that I did not, and I have two little girls, but are there things that we should do that if we could notice it earlier, we could actually have a different outcome?
I think obviously depending on where we are in a pregnancy, that there are various different signs. I think that in the first trimester, anytime someone has any red bleeding, any cramping that feels unusual or painful, definitely let your doctor know. We can definitely do ultrasounds to kind of further get more information about what is happening. But just because someone bleeds does not guarantee something terrible is going to happen. I've definitely have a lot of ladies who might bleed in the first trimester, yet carry a full-term uncomplicated pregnancy for the rest of the time, have a healthy baby at the end of the pregnancy. So just because something feels different, something different happens, doesn't guarantee something bad outcome is going to happen. So. Mm-hmm.
So are there certain things, so in your first trimester, that you should, limit certain activity or whatnot to get past that, the 12 weeks, right? Is 12 weeks that specific time where, you feel that you're in the clear?
Yeah, statistically speaking, like once you hit 12 weeks, if a little one is going to pass away from other issues, most times pregnancies do seem to, the miscarriages happen around by that time. So it is a time when we can kind of take a deep breath. The activity-wise, all the studies show that even if what we do doesn't seem to affect those kinds of outcomes. So I wouldn't change how we exercise, how we do things like that. If we're bleeding or having other issues, obviously that's different. But
Right, right. Does having a miscarriage or stillbirth mean that a woman can't carry a healthy baby to term, or they're going to have issues with their next pregnancy?
I would say that that is not the case at all. There's so many various reasons for a miscarriage or a stillbirth. And whenever something does happen, we try to understand a medical reason why a baby might have passed away. And then we try to do things to see what we can do to prevent a similar situation from happening.
What are
So
those reasons that our body may reject? Why do women have miscarriages?
I think that there's just so many different reasons. Probably the most common reason is probably just a chromosomal situation where perhaps when the egg and the sperm came together, things just didn't quite separate in the way we would want, and the little one was just not going to survive. Those are the most common reasons that we are aware of.
Okay.
Mhm.
So it's really our body saying that it's not healthy, right? The fetus is not healthy. It needs to pass. So instead,
Mhm.
but I think in our mind, and a lot of women may not realize why, like why their body can't, carry a healthy baby. What is going on? So it seems like there's a lot of steps that happen before that
Oh,
moment.
for sure. Yes, for sure,
Are,
definitely.
are there different times within the cycle of when you can conceive that can make a baby healthier versus not?
No, that would be great if we knew. That would save a lot of heartache, I think. But unfortunately, yeah, that's something we cannot. There's no specific time or specific ovulation or specific that would make a difference with an outcome.
Are there certain, after so many times of having, can you have too many miscarriages before, maybe as a doctor, you state that we need to stop, conceiving, or is there other avenues that you can take to maybe help, since naturally, right, you're still continuing to miscarry? Can you can talk through what should be the chronological steps that a woman should be thinking of if this is happening in their life?
Well, I think the number of miscarriages, that once again becomes a very individual situation, in that how much a woman can go, like what can a person go through um, before their heart is just so broken. It's just a situation of just trying to see what would be the best thing. Why is that happening? How far along is a pregnancy when something like this happens? Those kinds of things would definitely guide us to which direction someone should take.
So you said most of the time it happens before 12 weeks. What about those cases where it's after? What happens in those cases? Some people go almost full term, and then that last week something happens. Is it again just our body realizing that it's unhealthy? Like, can you explain why in those circumstances? Because I don't know why it seems like it's harder to stomach the further along you are, which truly, it's a baby from the time of
Mhm.
conception. So,
That's once again, it becomes so difficult. I think that there are so many situations that a little one may pass away. There's medical issues that can happen to a mother that can create issues to a pregnancy. There can be really unfortunate accidents that can happen. There's just so many different things that can potentially happen that would affect a baby. But which is why with the prenatal cares, we try to see people specifically on a certain schedule to kind of minimize any medical issues that might create problems or complications for a little one, and the goal to be preventing stillbirths and things like that.
what medical issues have you seen?
So medically, if a woman has like a blood pressure problem or even a blood sugar problem, different things that are not controlled, or if their body has an illness called preeclampsia, where the body almost basically attacks itself, where the body's so stressed out from being pregnant. Things like that can definitely happen and can adversely affect the baby.
Okay. What about women that may not have access to the healthcare system, or is it for them to go no matter if they have private insurance or not?
Yeah, so all hospitals will take care of pregnant ladies regardless of their ability to pay. All of us do our best to take care of them, with whomever is on call or whomever is covering the hospitals, even if they do not have a established care, things like that. Our goal, I think, in medicine is to help make sure access is available to everybody who needs it, and to prevent people to be in a situation where they don't realize they have these medical issues because they weren't able to see a physician or a practitioner of some form. Mm-hmm.
Do you have any advice? So when a woman does experience a miscarriage or stillbirth, they feel alone, right? Even sometimes connecting with their partner. What are some good first steps in those moments? Do you have any words of wisdom to help individuals that may be experiencing this for the first time?
Yeah, I think once again, such a difficult and unique experience for each mom, but I definitely encourage each mom to reach out to the network of their family and friends. I think the biggest surprise each of us has is how many of us have actually gone through similar experiences. And I do think it can actually bring us closer together. I mean, it's so hard that a lot of people do go through almost in secret, where people don't even tell other people they're pregnant until they're over 12 weeks, things like that. But I understand also because of the fear of having to confront a loss if something should happen.
So from a friend or family, to maybe start to take that stigma out, like how do we comfort them so that they don't feel alone, or that to maybe make those conversations easier, right? Like so they can share, and if something does happen, it's not like, I think the reaction is like, oh my gosh, I'm so sorry, instead of like more of a support, just trying to think of what can we do to support, to know that it's normal and we should be talking about it, and maybe it just wasn't the right time, and just to keep their hopes up. I mean, what can we be doing as a support system?
I mean, I think saying that you're sorry is never. I think showing that feeling of hurt for them as well. I think that's very appreciated. I think that I think the hardest part is if someone feels like, oh, my little one passed away at 6 weeks, perhaps I shouldn't be feeling as much pain as someone whose baby passed away later. I mean, I think it's just the goal from, I mean, I think it's more of not belittling one's experience depending on where they are gestationally.
So do you feel it's harder for women? There's sometimes you have to actually give birth even when the child's already passed, or a DNC, or whatnot. So what I just heard is it doesn't matter. It's every woman is probably still experiencing the same type of pain through their journey too, and that in general we should be supportive no matter what. It doesn't matter if someone carried longer or less. So how do you start to express that, right? How do you start to make a change like that?
I think that the more we encourage our patients to go talk to their family and friends, I think that just starts the conversation. When we open up to our families about what we go through, then they start speaking of their experiences, and as more words come out, as more people start speaking of it, I think then it will become. I mean, it's not something we casually speak about. We don't casually speak about any loss that we have, but I think that would be just the first step. Mm-hmm.
No, that's great. Melissa, do you have any questions?
I guess my last question would just be, if you could start that conversation, what might be the first thing that you would say to someone as they are grieving? I know I heard April say, I'm sorry, but maybe a follow-up of like one thing that what you as a physician say when you find out, something's happened, what might be something that we could, just words that we could use?
I think that as long as the mom realizes that you see her as a mom that has lost a child, I think that that acknowledgement is what we all look for. Even if we were pregnant once and had a miscarriage at 6 weeks and that was the only pregnancy we ever had, you still feel like a mother, even though you don't potentially have any other children that are running around you. So it's just acknowledging, I think, that.
So almost hearing, a loss is hard for any mom. That kind of loss is hard for any mom.
For sure.
It's a really powerful thing to say. I'm hearing what you're saying is acknowledging that they are a mom and that loss at any time is still loss.
Oh, yes. I agree.
Do you have any networks or support systems that you refer moms to?
I have a group of, we have different various counselors that we work with. I encourage people usually to reach within their family and friends first, because I think they know them the best and they know them, like what they would need the best to help through, and they'll be seeing them daily versus, once a week or what have you, kind of thing. So I always encourage people to go to their families first, or friends first. And then if it's still difficult, then there are different people we have to speak to, but it just depends on what each person needs, for sure.
Absolutely. Well, anything else to leave us with, Holly?
No, I think it's wonderful that you're doing this. I think that it is important to speak about this. I think that women, but it is still a very difficult subject because it's so heartbreaking. But it's hard to speak about anything bad that happens to us. So.
Well, great. Well, we really appreciate your time.
Thank you.
Thank you.
Thank you. Well,
Thank you so much.
This episode of Mental Health Minutes. Stay healthy, and until next time, friends.